Like most of us, because of the coronavirus outbreak, I'm stuck at home. As a 15-year-old, I wasn't quite expecting this to be my life as a teenager. Curious about what the world looks like amid the pandemic, I'm talking with people who are on the front lines, helping our society get through this difficult time. Sharing their stories gives me hope, while I'm 15 and quarantined.
I'm Dr. Dale. Live in Washington, D.C., and I work in this area and then also in the surrounding Maryland. I've been working as an OBGYN or obstetrician gynecologist for the last 11 years. Um, we mainly work at Holy Cross Hospital.
Okay, so can you tell us about your work pre-pandemic?
So as an OBGYN, there's three main roles that can kind of be divided in. One is the obstetrician part, or labor and delivery, where we work in hospitals, we deliver babies, and work that 24/7, all the days of the week. The next role is really office work, where we see patients in the office. We might be seeing them for routine checkups or for problem visits. And then the third role is really like surgeries, like doing hysterectomies or, ovarian surgeries, anything that has to do with gynecology.
So did you work through shelter in place, and if so, what were some of those challenges?
I did work through shelter in place. It wasn't as challenging as I thought. I did have a letter that I carried with me at all times, so that if I was stopped by, police or anybody, that I could prove that I was an essential worker and was able to get to work.
So how has your job changed because of this pandemic?
So my job's really changed in the fact that we aren't allowed to do elective surgeries during this time. Part of that is because we have to preserve PPE, or the personal protective equipment that we use to protect ourselves from infections from COVID. Because of that, and because of trying to also preserve ventilators that can be used during a surgery, just in case we run out of our own ventilators in the hospital, we would be able to convert the same type of ventilator that keeps you alive during a surgery and during anesthesia. We would be able to convert that to ICUs that would be able to take care of COVID patients. So for that reason, all the states decided to stop elective surgeries, or most of the states did, definitely this region. So that decreased my amount of work that I did. And then also in the office, we stopped seeing patients for routine visits. And because of that, the numbers in the office also decreased. And we tried to do more things from a distance, like through telemedicine. And telemedicine has really taken off during this whole COVID pandemic. So there's a lot of stuff that we do over the phone or video, like we're doing right now. And so that, I think, will also continue after COVID even goes away. And then the obstetric part of it really didn't change too much. People are still having their babies as planned. That's nothing that really changed. There were changes to like visitor policies. So now you can only have one visitor come, and if you're COVID positive, then you don't have any visitors come. In New York City, women who were having their babies actually weren't even allowed to have their husbands or anyone there.
Oh, wow.
So that has been a big change. And we also have to really take into consideration the OB patients that had COVID. So those patients we have to take care of differently, and they ended up being very high risk. In the beginning, we didn't really know a lot about COVID at all, right? Obviously, it's very new. So as we moved through and learned more and more, my job began to evolve differently and change as we discovered things. Even at the very beginning, I wasn't even allowed to wear a mask, even though we knew that there was a respiratory component to the disease, but everybody was so afraid of running it that they didn't want to waste that. And so then, of course, that changed, and now everybody's wearing a mask. So in the beginning also, we thought that really with pregnant women that there was no increased risk And then we found out that, yes, actually, they can be quite sick and they can look normal before they have their baby and afterwards actually become quite sick quite quickly. So we're still learning a lot, and that continues to be part of the challenge, because as we learn these things, we have to modify. But yeah, also, I know you had asked me kind of how things changed. The internal medicine doctors that take care of the patients who come to the hospital for many different ailments, those doctors were overwhelmed by the COVID patients who were also admitted to the hospital. And because they wanted to have a separate COVID rounding team of doctors that saw COVID patients and not COVID patients and other patients so that they wouldn't spread the infection, they needed more doctors to come onto their team. So they pulled from many different specialties. They pulled from, cardiology and, even ENT and also other specialties that don't usually come to the hospital to see patients. But we were also pulled to help out the internal medicine doctors. So even though I have 4 years of training after medical school just in OBGYN, and don't have the 4 years of internal medicine residency training, I needed to function as an internal medicine doctor, which all the doctors really pulled together to support each other. So that didn't end up being as challenging as it might sound. And of course, we have like a basic, understanding of internal medicine. So it worked out well. And I think it continues to work out well because we're working so well as a team.
So just a follow-up question. You said that you had to stop elective surgeries. Have the elective surgeries resumed?
So some of the elective surgeries have resumed, but they have to kind of start off slowly. Since we never kind of know what's around the corner with the pandemic, if it's really going to suddenly increase in numbers or not, we have to kind of move slowly at opening it up. So we are at about 25% capacity at some of the hospitals, and then we're trying to slowly increase it.
So, did you ever consider yourself an essential worker before this pandemic?
I did. I'm used to working on holidays and weekends and overnight. And when there's been blizzards and it's been really challenging to get to work, we still have to go in. So yes, I always considered us an essential.
So as a COVID first responder, how are you protecting your family?
So that's a really great question. It is difficult to know exactly how to protect them. When I come home, I don't wear my clothes from the hospital into the house. I take a shower when I come home. I try to wash myself for symptoms. I have had symptoms since this whole COVID thing happened, and I did have to go into isolation. So I actually came home from the hospital one day and just had to walk up the stairs, go into my bedroom, and stay there for a few days. So that's really difficult, especially given the fact that I have 3 small children. So that was a challenge for sure. I'm also a little bit more protective with my children. I don't let them, some people in the neighborhood have let their children kind of have play dates or go out with one each other, maybe even with distancing. With me, I have to be a little bit more precautious because I can spread infection from the hospital into the community, and anything that comes into the community in my house can go back to the hospital. So I have to be very careful.
So lastly, what is your message of hope for kids and teenagers like me?
Well, I know that this is a super challenging time, and I know it's been really difficult and not what anyone expected, but it's also such a great opportunity to be innovative and creative and really leaders. I mean, you're really the next generation, and this is really going to mold your generation. All these challenges are what's going to, allow you to define what the future is going to hold. So it's an exciting time of opportunity too.
Dr. Dale, thank you for your service. Thank you for helping everyone get through this difficult time. And thank you for joining us today.